Might seem like a distant memory, but nearly 5 years ago, COVID-19 was declared a global pandemic. Life came to a halt with offices emptying, schools going virtual, social outings canceled. The way we interacted was forever changed. So how do Americans feel about the pandemic today? Well, you can only imagine. To break that down is Pew Research Center Associate Director of Research, Alec Tyson. Alec, good to have you with us. How are you?
Great to be here. Thank you.
So a new Pew Research report was released looking back on the pandemic 5 years ago, practically to the day, and how it was handled. What were some of the findings of what Americans think about the pandemic today?
Well, we wanted to take stock of where folks are today. And when it comes to the health threat, for most Americans, that seems to be in the rearview mirror. Pretty modest shares view it as a major threat to public health today. And most folks aren't too worried about the disease personally. At the same time, it's hard to overstate the impact the pandemic had really on all of us. We find that 3/4 of Americans say it took a personal toll on their own life. And when we ask folks to reflect, as many as 72% say that at the end of the day, it served to further divide us as a country.
Yeah, 38% feel there should have been fewer restrictions along that. The lasting impacts, though, what was I guess the one that really stood out to you? Was there a surprise in your estimation, or did it kind of fall in line with basically kind of what you thought the people's perceptions and the impact that the pandemic had?
Yeah, it's a great question. And what area of life was untouched by the pandemic? That's one way to think about it. So one area we focused on were schools, or K through 12 public schools. What a difficult time for students and parents alike. And what we see in the data that in some ways kids are still working their way back from some of these disruptions when it comes to math and reading scores. At the same time, it's possible even here to see some silver linings. Let's pivot to work, hybrid work, or remote work. That was something that really not many folks did before the pandemic. COVID issued in a new area of remote work for some. Not everyone has a job that can be done from home, but for those who do, hybrid work has been a pretty positive thing. 7 in 10 tell us it helps them better manage personal and home responsibilities with work responsibilities. And 6 in 10 say it makes them feel more productive, certainly a point of conversation between employers and employees among some pushes to return to the office here.
So let's focus on the virus itself. And how are people handling COVID today and generally thinking about not only COVID, because it's obviously still out there, but other illnesses today?
Absolutely. What we heard during the pandemic was an enormous amount of public health information, social distancing, mask wearing, how to navigate. And so what we wanted to do in this survey is cast that forward to think about illness more generally. Everybody gets sick. What should you do when you're sick? What should you do when you're not feeling well? And what we found in our survey, avoiding contact with vulnerable people, that's widely agreed upon by large majorities of Americans that this is something that's really important to do if you're not feeling well. From there, there's some differences, almost echoes of the pandemic. We didn't always agree on things like masks and social distancing, and you see that to an extent in our survey data today, meaning should you stay home from work if you're feeling not well? It could be a common cold, you don't know what it is. Should you stay home or not? Should you call in from work? Should you wear a mask? About half of Americans say, yeah, that's really important to do those things. The other half say maybe that's less important or more up to the individual. Again, a bit of an echo of the pandemic era.
I think it seems like at the time, because none of us had any, even the professionals had no idea what was happening or how to prevent the spread of it, or people were dying by the drove, especially here, in the tri-state area. What we witnessed, it was just kind of throw it up against the wall and see if it worked, whether you're 6 feet, 10 feet, 12 feet away from a person, wearing a mask, not wearing a mask. Nobody had real concrete answers. So now looking ahead, how do people feel we'll respond as a country? Should there be another global health pandemic in the future?
Well, that's the big question, isn't it? After all we've been through, would we be better prepared for next time, right? On the one hand, only 16% think we would do worse than we did with COVID-19. And from there, we're split. About 40% think we would do better, but about an equal share say we would do about the same. But what we do see in our survey that's a clear source of positivity, local communities. 7 in 10 think their own community or their own neighborhood would do a good job dealing with a future health emergency. And even though the public health system in this country did take some criticism during the pandemic, 6 in 10 feel the public health system would also do a good job with the future emergency. So if you put that together, the strength or power of local community and the health system in this country, two sources of clear optimism in our data.
Well, let's keep our fingers crossed that none of us as a society need to go through this again anytime soon. It was a disaster. I don't care what anybody says. I can't believe it was 5 years ago. We had this conversation the other day. It seems like yesterday, and then it also seems like it was an eternity ago. And like I said, we're just on the 5-year mark. Alec, thank you very much for taking the time. We appreciate it.
Thanks for having me.
All right.